So I'm gonna clap. Okay. All right. Steve, this is a one. Did you say Steve or Steven is what you would like to be called?
Steve is fine. That's
okay.
Great.
Steve, this is a wonderful opportunity that you've given me to be able to talk to you about your book. And I saw it on, I don't know if this will come up backwards, but when you put a picture on Facebook, and I was like, oh, yay, someone talking about keto. And then I saw that it was like, this is a substantial book.
It got kind of big, yeah.
It's wonderful. This excited me. Like some people would be like, oh my goodness, but you specific, and also like this, I look at it often and it makes my mouth water. I mean, the salmon too.
It's a terrible diet. I mean, nobody can sustain it. Right?
It's wonderful. All that marbling on it too. Look at that.
Well, I'm glad to find another keto nerd like you, Lizzie, so this is great.
Yes.
Thank you for having me.
And, I am like, it's hard for me, the whole calculation thing. So I'm more of like carnivore keto because it's just simple.
Yeah.
And that's why a lot of people are like, the carnivore is just easier for them. But, and I have had zero problems with the carnivore approach, but I wouldn't be technically carnivore to the most carnivore-ish people. You know, I have my coffee with a little bit of honey in it, and you know, I'm not dogmatic. The older I've gotten, the less dogmatic that I've gotten.
That's probably a good thing. Yeah.
Yes. Yep. All right. So I am really interested in, like, we met at a retreat. Do you remember this, right?
Yes.
Okay.
That was a long time ago.
Yeah, it was a long time ago, and it was before I had kids.
Yeah.
I have since had 5
Oh
kids.
my gosh.
Yes. Yeah.
Wow.
So, and we've gone through quite a few health issues. We dealt with, I'm not sure if you're familiar with mold illness, like as a whole. Are you?
Bit, yeah.
A little bit?
Yeah.
And so we had mold, and a lot of people don't realize that they have mold in their home because they sometimes you don't even know. It can be a nice home, but it's behind a wall. Or in our situation, it was on the ceiling, and then downstairs, which we had bleached because an apartment guy, a manager of an apartment building, said, "Oh, when I see that, I just bleach it." And you're like putting people at risk, but the education out there is so lacking on that front. So it's a tragedy, really. What pushed you into the keto realm?
Right. Well, yeah, so I'm a physician, as you know, and I was happily going about my life doing internal medicine and pediatrics, which is my specialty. And then about 7-8 years ago now, my wife Janice, which introduces a lot of great things into my life, she decided to become a health coach and always had interest in nutrition and whatnot. And she ran across a book by Jason Fung called The Obesity Code. And so she said, hey, put your doctor hat on and read this because I think it makes a lot of sense. And I'm super skeptical, you know, because honestly, I'd been in practice for 30 years at that point. You know, like somebody's found the code for obesity. Sure they have. You know, I just really had not had any real success at that. But as I was reading it, you know, it's a low carb approach and people lose weight, but every diet book tells you that people lose weight. But then Jason said something that really caught my eye, and he talked about people reversing their diabetes. And I was like,
really?
No. You know, I'm an internist, like this is what I do, right? I'll be honest with you, for 30 years, I don't think I ever took anybody off their medication for diabetes unless they had like weight loss surgery or something major. We're taught it's a chronic progressive disease and you can manage it, you know, with medications primarily. And then eventually we get them on insulin and then they have a heart attack and die. And that was basically, you know, the whole operation. So when I saw that, I was like, okay, that's testable. And so I grabbed a handful of my patients and tried it, and bam, it worked.
Okay. This is a huge thing, is that you had patients that were like, okay, let me try this.
Oh, yeah. Yeah. In fact, that's what I've discovered. There's a lot of people who want to treat their diabetes and other chronic disorders without medication. You know, they want to do it by diet, lifestyle. If they've got any, there's a lot of people who want to get off their medication and so forth. So that's low hanging fruit. You know, that's people that this is made for. So when it worked, I was like, oh, that's when my mind just exploded. And I'm like, okay, they didn't teach me this in medical school. And I had to take a deep dive into the literature to see, okay, is this really true? And is it safe?
Yeah.
And the answer to both those questions is overwhelmingly yes.
Yeah.
And then the whole world opened up to me, and now I've changed my practice entirely, and we're starting a metabolic clinic.
Yeah. So that is so cool. I imagine that being able to help reverse these things, like you said in your book. Oh, by the way, it's entertaining too. Like this is not dry. This is really, it's big, but it's wonderfully written. That you felt like you found the cure to cancer, and you know, like the excitement that you have with,
and even more than cancer, right?
Yeah,
I mean, that's the crazy thing. Heart disease, diabetes, obesity, everything from PCOS to neurologic disorders. It was like God just sent this down in my lap, and it's like, if that happened to you, what would you do? You know, would you just keep it to yourself?
Yeah,
no, you know, you'd be shouting it from the rooftops.
Yes.
So that's kind of what I've been doing, and why the book. You know, it's my effort to try to get this out into the public. You know, I'm just a regular doc who's just implemented what the research is saying this is doing.
Yeah. So oftentimes people are like, oh, well, people don't want to change. They don't want to change their diet. They don't want to change anything they're doing. And that you have seen that it has not been the case. And now people probably seek you out in an effort to do it. Do your obesity clinic, is it mostly in Iowa, or do you do it nationally, or?
Right, so it's restricted to Iowa because that's where I'm licensed. So there was a time when people were coming, you know, Arizona and everywhere, and our legal team were like, actually, you're like practicing medicine here, so you really can't practice outside of the state of Iowa. So if you're in Iowa, then great.
I have a question though, like about that particularly, because I think it's wonderful to be local. Like let's not let's keep it non-centralized or whatever. I don't know.
Yeah.
You are only, like, if you're only giving like nutritional advice like a health coach, and you don't need to prescribe anything out of state, you would be able to, or is it still like you feel like you need to you're probably busy enough with just Iowa alone.
Well, that's true. There's no shortage of patients there. So that's not the problem. But actually, Lizzie, the thing is, this is an extremely powerful metabolic tool.
Yeah.
So it's not just like, hey, don't eat Twinkies and your diabetes is going to go away. So actually, especially if you're on, and this is, a thing for everybody listening to this, if you have diabetes or hypertension and you're on medication, especially for that, these medications have to be appropriately withdrawn. And I emphasize appropriately, because otherwise, hey, your blood sugar is going to bottom out, your blood pressure is going to drop. Those are good things, but you have to back off on your medication appropriately. I've had patients end up in the emergency room and everything else because they started this without appropriate supervision. And so that's the key thing.
That was one of the cases that you had just shown in the beginning of like, that's not a good thing. At least our emergency departments are really good at keeping people alive. We've gotten really good at that, which is helpful in some of the situations we put ourselves in.
Exactly.
So
nutrition for me went from being what I thought was irrelevant because most doctors don't get any real training in nutrition to now it's the biggest tool in my toolbox. I haven't put anybody on insulin in over 4 years.
Yeah.
I haven't. And I now think insulin's relatively contraindicated for type 2 diabetes. You should not be on insulin if you have type 2 diabetes for sure.
Yeah. Yeah, speaking of insulin resistance or diabetes, I mean, that's the root cause. Well, I'll say, how far does the roots go? You know, you've got these little
Yeah.
tentacles that go in the ground, you know, but like one of the
Yeah.
major tap roots, let's call it a tap
Yeah.
root, the
That's
tap
good.
root is like insulin resistance.
Yeah. That's a great point. And yes, you're absolutely right. There's a lot of factors that go into the obesity and diabetes epidemic we have today. I mean, we have 10,000 different preservatives, artificial flavors, colors, obesogens, genetic modifiers, everything we've allowed to come into our food. Europe has 300, so they're a lot better off than we are. But what those things are doing is huge as well. But by far and away, the elephant in the room, Lizzie, is insulin resistance and hyperinsulinemia. And when you treat that one thing, you make everything
Yeah.
get better. That's the amazing part.
Yeah, getting that, yeah. And that, I really had, so just a little bit about our, so I have a lot of like trauma from Nayeli. She was depreciating neurologically. She went from a 10-month, like she went from 2.5 years old at that time. She's now 6, but she started dropping and it was like kind of waxing and waning. Another doctor had said, man, it sounds like she's being poisoned every day. And I was like, we got her to a specialist, got an MRI done, and she had diffused white matter disorder, irregularity over her whole brain. So they're diffused. They said it was leukodystrophy, a genetic demyelinating disorder of the brain of which there is no cure. She would die. Don't worry, she won't die right away. It'll be like 3 to 5 years. As if that, like, I am standing there and I'm absorbing this information and I'm like, this is total, and then they said, there's nothing you can do. You didn't do anything, and there's nothing that you can do about it, but it's just going to, be progressive. And she had seizure-like events. She'd just like continue on that decline until she died. She would become disabled, kind of disconfigured, and she'd just die. So I had seen before that event, I had seen I had seen Terry Walls.
Oh, yeah.
Yeah, talk about mitochondria disorder. So that was in my brain. And then we checked her for gluten intolerance, like all of the parameters, like all of the genetics and, a blood test or whatever you could do. And it said no, so we were like, no. And then as I was processing, I'm like, I'm just gonna take it out because it's easy. For me, it was easier than I think almost anyone else because my sister was diagnosed with celiac disease, and so she already took it out, but basically the root of the cause was the mold illness causing a gluten allergy. So like when it just kind of overfilled the bucket, especially when she ate the gluten, and you would see massive neurological problems. And then at one point, I was like, as she was healing, getting better, I was like, okay, I'm gonna let her have this little peanut butter cookie at the lake that this guy had from Casey's. And that doesn't even have a ton of gluten in it, but she had it, and she was drunk after she woke up from a nap.
Yeah, yeah. And that's fascinating, with your daughter. And we see this, especially with leaky gut and so forth, an increase in inflammation. And I see a lot of patients now too who don't have any kind of the antibodies to gluten are negative. We do a small bowel biopsy, it's negative. But there's over 20 different wheat proteins that people can be sensitive to. And that is a thing. And I see a lot of patients with chronic headaches or other problems, and they've had the MRIs and they've had the different medications and nothing's working. And I say, just go on a gluten-free diet.
Yeah,
See
try
what
it out.
happens. And many times their headaches go away, drops in inflammation, all those things.
Yeah.
And not only does gluten increase permeability of your gut, which then causes an increase in inflammation throughout your body, but it also decreases the permeability of the blood-brain barrier.
Oh.
And so, especially for someone like your daughter, that's huge.
Yeah.
Because now you've got a lot of inflammatory processes that are the brain is just extremely sensitive to inflammation.
Yeah.
Especially in something like leukodystrophy. And so now you've increased inflammation in there if they're eating kind of gluten, plant-based foods. And it isn't just gluten, it's all the phytates, the anti-nutrients, the pro-inflammatory lectins, everything that are in the whole grains that everybody, thinks are great. So it's a problem. So yes, I can see where going on a carnivore kind of diet would be great for
So she's not carnivore. Like, I'm the only one basically in my family that's pretty much carnivore, but I just do heavy meat and fat. So one thing I it's fun to see feel vindicated when you experience something and then you see it, with doctors and stuff, because you're talking about butter. And one thing I did, I had this time where neurologically, and this is seen in mold toxicity too, mold illness, is they see like bipolar. And I had a manic time learning, and I had a manic time that I've never had since. But I started drinking hot cocoa, and this was before I went carnivore, hot cocoa with 2 tablespoons of butter in each cup. And my husband was like, what happened? Like, what did you do differently? Like, I was modulated. And I started rubbing butter all over my body. That was so funny. It felt like a drug. And actually, it's also got the fat-soluble vitamins. So not only the butyrate, like you were talking about, right?
Yeah,
but it's got all the fat-soluble vitamins and K2. It was grass-fed Kerrygold butter. Or no, I think I was rubbing Supernatural on me at the time.
Oh, okay.
And and K2, now that you bring up the blood-brain barrier, K2 is one of those things that help increase the thickness of the gut. And I think would the brain barrier? Membrane integrity, probably?
Yes, exactly. Membrane integrity, and it interacts with vitamin D very closely. So that vitamin D, everyone knows is for bone health and whatnot, but it's also with calcium. K2 kind of tells your vitamin D where to lay that calcium at. And if you don't have enough K2, you start getting calcium laid down in places you don't want it, like your coronary arteries and stuff. So, that's very important. And you're right about, in fact, I just read a study today, was published in JAM about K2 for muscle cramps.
Yeah.
And it's actually very helpful for that. And they describe how it helps with muscle membrane activity. So, that's all. Yeah, excellent. So a lot of neurologic disorders are toxin or infectious. You look at dementia. Dale Bredesen at UCLA has done a lot of work with that and showing that, hey, with Alzheimer's dementia, it's not just one thing, and it's not just a genetic thing, although there may be a component. But you've got infection, you've got toxins, you've got other things that come in, inflammation for sure, just similar to what sounds like happened with your daughter.
Yes, 100%. And I would I think I have to write a book to get attention or something, because I told Mayo, I'm like, by the time we got to Mayo, she was like healing, and I'm like, hey, my daughter, she's like healing. You said it was genetic leukodystrophy, and no, we didn't find a genetic, but 40 to 30% of leukodystrophy is an unknown cause. And even if there's a genetic, that doesn't mean everything. And people when they hear genetic, they stop.
Right.
And it's easy for the doctor to just say it's genetic, not that they are wanting malice, but also they don't realize the epigenetic potential and optimization
Right.
that can be had. And the effect of glyphosates is, am I
Yeah.
saying it right? Glyphosate or
Yeah.
glyphosate?
Roundup. Yeah.
That it has on our expression of many genes. It's
Yeah.
just, and the pH differences that it makes, it can lower, like basically lower the pH of your liposomes. So it's a liposomal storage disorder, right? And
Yeah.
oftentimes we're seeing low stomach acid instead of high stomach acid, and we have acid reflux because we have low stomach acid, and it's actually not enough acid in our stomach to digest what we've got. And I'm like, well, a lymosome is a stomach in every cell. So what does that mean? What is it? If we have low stomach acid, which a lot of these kids have, if we have low stomach acid in our stomachs, what about our cells? Are these kids having low stomach acid in their individual cells?
That's an interesting point. And then you bring up the fact that, I mean, the high stomach acid that normally should be there kills stuff,
Exactly.
So when you ingest mold, bacteria, whatever,
Yes.
that's why your small bowel is generally pretty sterile normally, plus bile acids. So when you make it, you decrease stomach acid, you've got more mold or whatever coming through, and then you increase gut permeability.
Yeah.
Now you've got a perfect storm for increased inflammation, which can go throughout the body.
Yeah, and also the mold can actually make the gut have more permeability too.
Yeah.
And then it acts, like it's just a conundrum. It's a snowball. It's like, what thing came first? Oh, well, we don't actually know for each case, right? Like, it's just a downhill slope. But it seems like I feel like you can climb up really fast, really quickly.
That's really great that you've discovered that. And the sad part is you had to discover this on your own.
Yes.
Pretty much.
Thank you.
Like.
Thank you. I feel like I feel like it's an apology to me, and I feel good feeling apologized to.
Well,
It was
absolutely.
awful.
Yeah, the medical community is blind to a lot of things. I mean, medicine should be humbling because there's a lot we don't know.
Yeah.
I mean, one of the things I like to do is read old medical books.
Yeah.
And I look back at 100 years ago, 150 years ago, and you're going, oh my gosh, the thing they were doing, bloodletting and everything else. And it's like, this is crazy. But I know that 100 years from now, we're going to look back on what our standard of care is today and go, what were they thinking?
Well, think about bloodletting. Sometimes, even in your book, you're saying, they were doing it for fever, right?
And others,
Or some other things. But bloodletting in some situations, giving blood, and oftentimes it's seen like giving blood helps people feel better.
Polycythemia and all that.
And in some ways, it's like, well, if you have too much toxins running around in your blood or a poor microbiome running around in your blood, maybe it dilutes it because your body has to compensate by making more blood and more, I don't know, I'm playing with it, the idea.
We're kind of at the early stages, especially when we talk about gut integrity. There's a massive amount of research going on about it. I think the bottom line is people know it's important, that it's a major driver for all sorts of disorders, autoimmune, inflammatory, cancer, obesity, liver disease, especially neurologic disorders as your daughter's case. And yet we don't have a crystal clear idea of how to effectively treat it in every case.
Yeah.
Or what the best microbiome is either in that regard too. So getting there, I think, but it's complex, that's for sure. But boy, I tell you what, your diet plays a major role.
Yeah.
And just getting off the standard American diet with all
Yes.
the sugar, processed food, and it just makes complete sense. And increasing fiber is fine. And, these kind of things improves gut integrity. We know that.
Yeah.
So why not do
And
this?
I
Use
haven't,
the simple things.
so because carnivore does not have the fiber, I will say right now, never had a pooping problem without the fiber. And now
Yeah.
I know that there are some like good microbes like that are eating the fiber, but a lot of these practitioners that are helping people with carnivore are noticing that the microbiome's fine too. But the thing one thing I think is really helpful is it helps your thyroid health. Like, and your thyroid, or even just all those other things, if you have more detoxification skills because of the food that you're eating, because of the coenzymes, enzyme cofactors are increased, and your minerals are increased in your body, and your, I think that it would just require less input of like iodine. I love iodine. I'm crazy about iodine, boron, and animal fat. Like those are my 3 things that I love so much. But you see, like with the keto flu, or like some of these detox symptoms that I've seen. Oh my goodness, my birds. I'm gonna roll them away. I'm gonna roll them somewhere else. I rolled them into my bathroom.
Okay.
So I hope they can't be too
It's a
loud.
nice kind of comforting background noise.
I don't know.
Yeah,
People
great.
are going to be too annoyed. People have different hypersensitivity issues. So listen. But okay. So where were we? Thyroid health.
Yeah. So, another big thing that you've already pointed out, is thyroid health. And, I'd say, another big factor why keto and carnivore diets are so effective is that they're strongly anti-inflammatory again. And a lot of thyroid problems, a lot of women have Graves' disease or Hashimoto's thyroiditis, driven by kind of an autoimmune process.
Yeah.
And especially if you catch that early on, it's absolutely, you can stop it in its tracks.
Yeah.
Because a lot of that is due to, again, poor gut integrity.
Yeah.
So, and by correcting your diet, you improve gut integrity,
Well,
you lower the inflammation, and you get rid of the problem.
Yeah, you're making your body more resistant to you're resilient, I'll say, and resistant, I guess. Like you're making your body resilient to the pathogens that are coming your way, like the mold, and like other things around you. Now, being suppressed in an environment that continually is feeding you mold is not gonna get you really happy. You can move from Nutrition with Judy. That's a channel that I like. I have binge watched all her videos. She's really great. But she's seen with the mold illness or the chronic, it can be another toxin, but she's seen with the mold illness that on carnivore, these people go from an F in health to a C. But she's just really like, man, I want to get them to an A, and usually she finds that there's that mold exposure, either past or current or both. And then she's able to eradicate that, correct that problem in their environment to be able to then help. It's like helping the microbiome of your home. That translates into helping yours overcome.
Well, I think you've hit on a big subject there, because it's really an entire ecosystem.
Yes.
It's in your gut, but it's in the soil.
Yep.
It's in your home. And it's not just a microbiome in your gut. You got microbiome on your skin, in your mouth, etc. So I think we're going to be discovering, that even beyond mold, there's all sorts of chemical additives and off-gassing of plastics and stuff. We're going to probably discover, like I say, 100 years from now, we're going to just say, oh, man, these guys are walking around in a pretty toxic environment.
That it will be, so pollution, the thing that biodegrades pollution the best is fungus.
Yeah.
And fungus thrives in pollution. So yeah, it will be interesting to see like what will be the future.
Yeah, exactly. Yeah,
Because there's, like you're saying, there's so much more to be discovered.
absolutely. Yeah.
Okay, so I've got all these like tons of highlighted things. I thought, okay, so speaking of microbiome,
Yeah.
I've read Super Gut.
Uh-huh.
Oh, have you read it or
Yes.
know about William?
Yeah.
I think it's William Davis, right?
Yep. Bill Davis. Yeah.
And I loved it. You were saying with the current state of widespread dysbiosis due to abnormal gut microbes, is it any wonder we seem to be at each other's throats? Could fixing our gut actually help bring people closer together and dial down confrontation and polarization?
It's a crazy thought, isn't it? I mean, your gut, I usually introduce this to people by saying, you got 10 trillion cells that make up your body. You've got 100 trillion bacteria in your colon.
Yeah.
And they produce more hormones that affect you, especially your brain, than you do. So this whole the concept was not there when I was in medical school. I mean, we knew we had bacteria in our gut. We just thought it was kind of a icky. But actually, it's kind of like which is the dog and which is the tail. I mean, it's like we're a host for these bacteria, and they're producing all sorts of hormones that affect our brain.
I didn't think about them producing hormones. I guess that would be their metabolites, right? I hear the word metabolite, and that would be a metabolite of them.
They do. And, and if they're not fed right, they produce hormones that stimulate you to eat.
Yeah.
And then there's different hormones that stimulate other factors. So it's incredible.
Yeah, like craving sugar.
Yeah, exactly.
Yeah.
And there's even hormones that are produced by bacteria that will provide behavioral changes to people. I think I mentioned some in there, like they've done studies showing that people have given a certain type of strain of bacteria, they're calmer, they're, it helps improve anxiety.
Yeah, so,
and so forth.
L. reuteri was one of those that
Yes.
colonized the small intestine,
Right.
and that's not usually a place colonized, but it colonizes the small intestine and instigates the production of oxytocin.
You have read this
Oh,
thing. Wow.
yes. I am very, very intrigued by that whole system. And also, okay, this is a little bit of a bunny trail, but I think you might find it interesting because it goes along. I'll say it actually goes along with what we're talking about. The mold illness causes a decrease in your antidiuretic hormone. And they have done brain hormonal studies on prairie dogs who are usually monogamous, which means they pair up, right? Mm-hmm. That's the word for it, right?
Yeah.
Okay.
Yeah.
They've done studies that if you decrease that hormone, they all of a sudden become promiscuous with other partners.
Oh, gosh.
I'm like, and Jill Chris, this one doctor, she was saying that, well, usually the woman is affected in the home. She has some kind of thyroid problem, or she's getting depressed, or bipolar, or this or that. And the guy is more resistant to it because he's like, I don't think there's a problem. Like, it's going to cost him money to remediate or whatever. But also he's not feeling it. And I'm like, yeah, but he's got, thinning hair, the fatty liver and anger issues. And I'm just thinking how much our microbiome and our metabolic health is creating an epidemic of separation.
Yeah.
And isolation.
Yeah. It's incredible. Right now I would say in terms of the low carb world, the cutting edge is behavioral health.
Yeah.
Everyone knows that, like keto is best for reducing weight and diabetes reversal, but both Stanford and Harvard right now have metabolic clinics to treat their psychiatric patients.
Oh.
And so we're starting to see some tremendous things coming out, and not just your simple garden variety anxiety and depression, but bipolar disorder and schizoaffective disorder. I saw an interview where Chris Palmer, he's a Harvard psychiatrist who's been doing this. He interviewed a patient of his and it's on YouTube, you can watch it, but or a part of it, and she had this schizoaffective disorder, and I'm talking she was homeless for a while, probably substance abuse, in and out of abusive relationships. I mean, she'd been through convulsive shock therapy, every drug you can imagine, in and out of rehab, suicide attempts, the whole 9 yards. And finally, she was homeless. Finally, he was like, we got to just try keto. And so they did. And within weeks, she was better. Okay. And now when she was when I watched her interview, she was an MIT PhD candidate.
She was?
Yeah. And now she's graduated, and
it gives you passion.
Oh my goodness.
It gives you passion.
And it got her life back.
Yeah.
So even today, though, she will say, hey, if I go off keto, the voices come back. But if I go back on keto, they go away.
I wonder if, I'm really big on, okay, so I did the iodine, so I learned about iodine through Brownstein, and through the iodine crisis, because at first I was like, I don't know about this iodine. Everyone's saying use salt that's not iodized, because that's the salt that is a better salt, but it's lacking the iodine. And so years, I think I went without iodized salt, and then I wasn't getting iodine any other way in the body. And then they don't put enough iodine in the salt, and salt isn't actually a good medium for getting iodine. And they used to iodize bread, and now they bromate it. And I guess going back to that keto flu thing, and do they have a keto rash?
Yeah, there's a keto rash. Yeah.
Bromide. So when there's more than one way to skin a cat, right? You don't have to take 100 milligrams of iodine every day for a month like I did, and then start to lose hair. But then I took Boron, and then I stopped, and then I felt really good, and then my back pain went away. Anyway, I'm just kind of extreme. But when you improve your thyroid function, I just feel like meat has to have more iodine in it than what is said. And I don't know, whatever. That's a question mark for me. But you see the thyroid working better, and then you see that, like, there's a bromide rash that looks the same. It looks the same as that rash, the rashes that I've seen with carnivore rashes. And, it could be quite a few things, right? It's basically getting the junk out of your body, maybe?
Well, a big part about the keto flu, you mean?
A keto flu and rash?
Oh, and the rash? Yeah, I think the rash is a little mysterious, because it tends to go away when people introduce a few more carbs.
Oh.
So that's kind of interesting. I'm not sure why. And it's pretty rare. I think I've only seen a couple cases out of thousands. But, keto flu is more, kind of, because insulin causes your kidneys to retain salt and water. When your insulin levels fall, because you're not taking a lot of carbohydrates to stimulate insulin secretion, your kidneys get rid of a lot of excess water. And with that goes some minerals, sodium, potassium, magnesium, and others. And so you need more of these minerals, and then you need more water. And it's kind of a transient phenomenon, right? So some people do remain very sensitive to mineral deficiencies as they remain on the ketogenic diet. And so they need quite a bit of salt and such. Other people, not so much. But that tends to be where it seems to come about.
Yeah. Do you ever do hair mineral analysis tests at all? Are you familiar with that? Or not really
Not for
needing?
that.
Not really
No.
need it?
Yeah. No, I haven't really needed it. And most people, in keto's, when they're eating a whole foods diet,
Yeah.
they're getting plenty of, especially with animal products, they're getting
Yes.
loads of the vitamins, the minerals, all the essential nutrients they need.
Yeah.
Coming off of the standard American diet is
Yeah.
hugely beneficial.
Yeah, and that fat. So the Jill Krista, that
Yeah.
mold illness doctor, she's like, because you said in your book even that they noticed that higher fat diet for some of the mental health. And that's one thing they noticed with the carnivore diet is like when they go, because there's a lot of fat and there's a lot of animal stuff, like the mental health improvement is very fast. Well, I experienced that with that butter, like almost instantly feeling. Jill Krista says with the mold illness and also some of these other toxins that are lipophilic, so they love the fat, so they cling on. All of our cell membranes have phospholipids. They are fat. There's fat. And then those fat soluble vitamins we're like lacking so much of, and we've got this seed oil that's like dunking us up.
Right. Yeah. Especially we get way too much omega-6s.
Yes.
It's an essential fatty acid, but we only need a small amount of it, and we're getting tons more. So,
And not enough the omega-3.
Right, which is much more strongly anti-inflammatory.
Yeah.
You can measure your omega-3, omega-6 ratio, which
Yeah.
is helpful.
That is really nice.
Yeah, so that drives a lot of, I think, the seed oils, soybean oil. I mean, here we are in Iowa, right? What are we, monocrop agriculture?
Corn and soybeans, corn and soybeans.
Corn and soybeans, corn oil, soybean oil, and all the stuff that goes with it.
Yeah. Yeah, we need to stop.
Yeah, I wish we could. Yeah, that brings up a huge question for subsidizing, the grass-fed beef rather than, corn and soybeans.
I wonder if that's one of the things they might do.
Yeah, it'd be nice.
Well, if you're gonna make McDonald's change to tallow,
yeah,
I
right.
mean, you might have a contract with them. Well, we'll help subsidize meat, and a lot of the regenerative agriculture. Woo,
Yeah.
I love it. I was into that before I knew about, more of the keto kind of stuff, the carnivore and keto realm of things. But
That is awesome because we live in Iowa and we're actually fortunate. I mean, when I buy a half a cow, I know the farmer who raised it. I know it was grass fed. I know it was humanely processed. And all that benefit. And honestly, most people in this world don't have access to that.
Yeah.
And you can overlay the obesity epidemic onto poverty. It's overlay, and there's a lot of food deserts out there.
Well, I have family that is just, they're just like, well, the cheapest thing is the carbs. The cheapest thing is this. So like all of that processed food is cheaper. So what do they buy? That.
So, so I've addressed that quite a bit because a lot of people are like, hey, I can't afford to eat salmon and grass-fed beef and all that. And I get that. It's hard to beat a big $4 pizza to feed your family, right? Or something like that. However, and this is key, I mean, you're going to probably not be eating out very much.
Yeah.
Which in and of itself, I mean, you can't go to any fast food restaurant for under $12,
Yeah.
So that's number one. Number two, you're going to eat less. I mean, the fat, I don't know about you, but the vast majority of people on carnivore or keto, 1 or 2 meals a day, probably.
I don't even calculate my meals a day. I don't get hungry as much.
Yeah.
And also my fat craving is high. Like I crave meat. I can sit down at a table, everyone's eating ice cream, and I can think to myself, my body doesn't look at it and say, give me that. Like it's serious. It's just like seriously, when you get to that point, you're just like, it's really cool. It feels
Yeah, it is.
empowering.
Yeah, you're free, right?
Yeah.
You're free from the chains of and these foods are made this way on purpose
Yeah.
to give you the right mouth feel, to give you the right crunch,
Yeah.
to make them as addicting as possible. The old Lay's potato chip commercial, bet you can't eat just one.
Yeah, you
You know,
can't.
you can't.
Once you pop, you can't stop.
Right, and they don't want you to stop.
No, they
So it's
don't.
like we've had, over 50
So
years
then they
of
can
food
give us the
chemists.
GLP-1 blockers, or did I say it right?
Right.
The
Yeah,
Ozempic.
exactly.
And lose your
Exactly.
lean muscle. Get some Ozempic butt. You
Yeah.
know, like that, lose your butt.
Yeah.
Put it on your stomach. No, maybe not. I don't know what they do. I've just heard of Ozempic butt. But going back to the fat,
Yeah.
the secret to pollution is dilution, Joel Christus says. And when you put more fat in your diet, you're also, I guess it probably helps your body say, I've got enough of this. I can recycle and like make some more cell membranes or repair things or, all of it.
The other thing that comes with fat is protein. So,
Yeah.
when you're eating, protein's the most sought after macronutrient by your body. Fats are generally energy. I mean, yes, you need them for soluble vitamin absorption and other things. There's some essential fats that your body can't make. You must eat them. There are no essential carbohydrates.
Yeah,
Zero.
none.
So you actually
Zero.
need none. And also they provide no satiety.
Yeah.
You can eat, I tell my patients, you can eat 6 cookies, you can't eat 6 pork chops.
No.
So
Yeah.
there's a reason for that. So and so getting protein's generally not used for fuel because it's used for
Yeah.
enzymes and antibodies and just about every important function in your body. And so that's the thing that's really made. Robbenheimer and Simpson, I talk about this in the book, the whole idea of protein leverage, which is interesting.
Yeah,
Just-
I took notes on that. I highlighted a bunch. That's just, I mean, like a lot of the carnivore people, they're like, you have been starving your body. And like
Yeah.
you said in your book, you're like, diet's not going to work if you're always starving yourself.
Right.
So they
Right.
like have people overeat the protein and gain weight before they even try to help them lose weight. And those
Yeah.
people that actually gain weight actually gain the muscle mass.
Muscle mass. And it's crazy, Lizzie, that I did a literature review on protein. And this is amazing. Okay. There is every single study, it's a scientifically proven fact that looks at low protein versus high protein. I don't care what you're looking at, diabetes, weight loss, food cravings, etc. High protein wins
Yeah.
every time, every single time. Why we're not shouting that from the rooftops, I don't know. The latest USD dietary guidelines are now to reduce protein intake even more.
No, that's going to
yeah,
change.
they
I
wanna
will tell you
reduce it
that.
even
That's
more.
going to change because at least right now we have the ability to decide for ourselves what protein
Yes.
intake we have. So I'm glad about that. And we can still farm cattle, but they were actually in I think the Netherlands were trying to, or I might be saying the wrong place. They're trying to suppress the cattle ranchers from they're making it very hard for the cattle ranchers
Yeah.
because they want this plant-based.
They plant-based. It's crazy. I mean, they're blaming cattle farts for global warming. I mean, that's insane. So, I mean,
While
it's
we're
crazy.
spraying in, I don't, right.
Yeah, it gets crazy. But the fact is, and it's a scientifically proven fact that protein, especially animal protein, is far better for you, and it's hard to eat too much. It really is.
I think about my cats outside, and they're outside and they're hunting, and they like farm cats. When have you seen a large farm cat?
Yeah.
You don't really, and they don't even eat a lot of their cat food because
Right.
they prefer to go and eat meat. They're carnivores. If you look at a bag of cat food,
Yeah.
there's wheat in it. There's
Yeah.
grains in it. when is a cat going to eat a piece of bread? When it's starving, maybe, and there's like some mayonnaise on it or something like that.
Yeah.
I don't know. Like they just, you know, and they're the most carnivorous creatures that we've, you know, like wolves. You know, it's just, it's amazing that we're trying to, and then the animals are having some of these metabolic disorders too. Fatty liver and all this.
Dementia, everything
Oh,
else.
dementia too. I know
Yeah.
that there's something
Yeah.
that was like leukodystrophy for some canine that is even genetic, but it's like we're genetically pushing these people over a cliff with the
Yeah,
susceptibility.
Absolutely. Yeah. Our standard American diet, and everybody knows this, is terrible. And it's
Not everybody knows it, I guess.
Well, yeah. No, it sells. That's the problem. And, you know, but the research is clear. I mean, it's driving the entire metabolic syndrome, and which kills 90% of us in America today.
And our quality of life.
Yeah.
And
Right.
I'll go back to the microbiome and the behavior modification metabolites that these things are giving us. You are a believer in Jesus. We met each other at, so my mom pushes back and she's like, you cannot blame everything on mold and that's, and it's true. So we have this, like I guess we just have to be super self-controlled or something. I don't know, but some people, I don't know. Do you ever get pushback sometime? Maybe you don't because you're a doctor, but because I'm not a doctor, I'm interested in this stuff, and then people kind of think, oh, it seems like an idolization of yours, or Jesus is the true healer, and that's true.
Yeah. You know, I hear what you're saying, Lizzie, because the reason this book is so thick and everything is because I wanted to back up what I'm saying. You know, I wanted to show that the evidence is there, and we call our program "Living by Design." Yeah. Because we're designed to live a certain way, just as you were talking about your cat. You know, designed to eat meat. You know, it's designed that we are designed to do that too. A lot of times I talk to patients and I ask them, I say, okay, what is freedom? What is freedom to you? You know, and most people talk about release of restraint so I can do what I want, you know, kind of thing. And it's, there's partly that, but that can be taken too far. I mean, because, you know, the old adage, you know, what if a fish wanted to live on land? It wouldn't go well, right? I mean, he'd flop around and die. And, you know, so actually true freedom is not doing whatever you want. True freedom is living according to the way you're designed. And when we operate crosswise to that, we end up being less free, you know, and burdened with diabetes, obesity, fatty liver, arthritis, and all the things that go with it. And when we live according to our design, actually freedom in that sense requires restraint. It requires that we live within certain parameters. And that includes the way we feed our bodies, that all of a sudden things get better, you know? Yeah. We live in a fallen world. Yeah. And nobody gets out of this alive. Something's going to happen. You know, I get that. But I would say 80% of the things people see me for are self-induced. Yeah. They're the product of their own, you know, personal choices, or it was inflicted on them by somebody else. Yeah, or just not realizing if somebody knew that they could, I know that if somebody knew that they could eat a big, fat, juicy steak with all the fat on it, and it be okay, I think, and safe, a lot of people would be like, that sounds like a good idea. Like, I like that idea. I used to, before I had kids, I used to make a steak, and I would be like kind of lazy. And one night I'm like, let's just have smoothies and a steak. So I'd make like a fruit smoothie and eat steak. And I felt like I was being like bad. Yeah. And now I'm like, oh no, this is wonderful. I love the freedom of being able to just be like, no, it's okay if I just eat steak for
tonight. And,
Yeah.
you know, if I want to eat something else, I can. I have liberty to do that. But
Yeah.
it's freeing to know that it's okay to
Yeah,
have that fat and to have that steak.
There's a great book written by my friends Jeff Gerber and Ivor Cummings called Eat Rich, Live Long. And I like the title, Eat Rich, Live
Yeah.
Long, because
Yeah.
that's what we're talking about. That, you know, people often think, oh, keto or carnivore is crazy, or it's extreme, or it's probably a nasty diet. Actually, it's wonderful, like you saw on the cover of this book, you know, right?
Oh,
What
it's so
was bad
wonderful.
about that? You know?
Wonderful. I
it's-
still, yeah. Mouth
So
watering
it's like,
every time
I
I'm
love
looking
it
at it.
when usually about 6 months in or so, when patients come back and they've lost the diabetes, they've lost weight, they feel great, come off some medication. But when they say, you know what, doc, I love the food. I mean,
Yeah.
I look forward, and I do too. I mean, we eat really well.
Yeah. I
And
could
I look
eat
forward to
avocado
my
with
meals all the
salt
time.
and I
Oh,
just
yeah.
peel it and then eat
Yeah.
it. Like,
Yeah.
that's so good. Oh, that's so yummy.
It's like, it's not a when it's not a sacrifice, then that's awesome.
That steak, look how dark it is.
Yes.
You know that's a grass-fed steak
Yes.
when you see how dark that is. And I don't know if it's a steak or chuck roast, and I don't even know. But when you compare the color of this, you know, you just see, and the color of like one from the store, like major different. And you have to slice off the oxidation of the one in the store so you can see the color, the true color of the meat. I'm like, that is filled with a lot more riboflavin and omega-3 and all that good stuff, probably more minerals, lots of yumminess.
Yeah.
One thing that's interesting though is these people on carnivore, a lot of them, and carnivore is like a keto, it's a sub
Yeah,
of keto.
yeah. Yeah, it is.
They have noticed that with people, even though the grass-fed's better and is better for our environment, they have noticed that the other meat, people are healing. People are also healing. Now, of course, you're going to have a lot more minerals and vitamins that are going to be helpful when you go grass-fed. But if indeed those people that you're talking to can't do it, you know,
Right.
like feel like they cannot afford that,
Yeah.
I almost think it might be better if they just, you know, engorge on some non-grass-fed beef rather than
Yeah. No, that's a great point.
rather than
In fact,
try to implement carbs, you know, into their
oh,
diet.
Absolutely. So what we talk about is progress, not perfection.
Okay.
And, you know, so yes, there's people, I get it. I mean, it'd be great if everyone could have grass-fed beef and
Yeah.
wild-caught salmon and free-range, you know, eggs and et cetera. But not everybody can. That's fine. You know what? A deli chicken is okay. You know, that's okay. Stay away from, you know, bologna or some kind of
Yeah,
very
maybe.
processed hot dogs, you know.
Well,
If
it's
you
got a
knew
lot
what
of
was
sugar in
them,
it. People
you
don't
wouldn't
realize
wanna
that
eat them.
there's tons of sugar in those.
Oh yeah, and they've sucked out the protein. It's
Oh,
garbage.
oh,
It's not real
what?
meat anyway. So it's
They've
yeah,
taken there's not enough,
lowered the
there's
protein.
not really,
Oh, absolutely. So that stuff is horrible for you and stuff. But regular meat is fine. It doesn't
Yeah.
have to be grass fed, and that's okay.
yeah. Yeah, and that's a wonderful liberty that people can feel like, because sometimes when some people are just very black and white, and so when they're told to do a certain diet or whatever, they feel rigidity and like, in order to do this, I have to have this. So having that
Yeah.
flexibility and feeling free, you
Yeah.
know, from that is a good thing. Of course, it's good to support grass-fed practices and stuff because it's good for our planet.
Absolutely. The more organic you can make it, the better, and you can strive for that. And actually, I would argue that as you get more and more into it, you realize, hey, I'm not eating nearly as much. I'm eating higher quality food, which I might spend more initially on that, but I'm eating a lot less. I'd say at worst, it's a wash.
Yeah.
Okay.
Yeah.
And so you're actually going to be
Well,
fine. And then when
and
you
then-
add in the health benefits, then
And the
it's
cost of
clearly
not
much
having to
better.
medicate yourself in the future,
You come off, a $1,300 a month drug.
being
Well,
able to go for a hike with your grandchildren
yeah,
or
yeah,
climb a
exactly.
mountain like you.
Right. Yeah, that's why we're doing it. Keep it up with 12 grandkids. It keeps us
Yeah.
busy.
So you didn't really, were there some health goals that you had in personally?
I didn't think I did when I first started this. I wasn't obese. I thought I was fine. I had chronic back pain, knee pain, but it was,
Oh,
kind of minor, but always felt tired in the afternoon. Biggest thing I noticed is, I don't take any medications. I'm not on any NSAIDs anymore. And I don't have any fatigue or need to take naps or anything like that. Brain energy goes up 110% on keto.
yeah.
And that's almost universal. Within the first month, that patients come back, and I've tracked over 1,200 patients with this. So it's
Yeah,
amazing
that's
how
it. That is
reproducible
so
this is.
awesome.
And within the first month, they notice that their energy levels up, their mental clarity is better, et cetera. That's what I noticed.
So here's the thing that I was thinking about. So they say alcohol, you really want to get that out of your body. So you use it, you waste, it's energy. So you use it first. But
Yeah.
with carbs, all of a sudden, like glucose, this is the preferred energy source for the body because it's being used first before ketones.
Well, I'd push back on that a little bit. You often hear that stated. And glucose is kind of the universal energy molecule. Every cell in your body will use glucose. Your liver will make all the glucose you need. You don't have to eat glucose to get glucose.
Yeah.
Your liver can make glucose from both proteins and fats, etc. But it doesn't just do that. Well, this is what the design part comes in, right? The liver will crank out ketones when you don't have carbs around either, which is the ketogenic where that comes from. And it turns out that, especially for the brain and the heart and the gut, they prefer ketones if they can get them.
Yeah.
And that's, I think, fascinating. And that's an area where I think the research needs to go is
Yeah.
why does our brain and our
Love
heart especially love
fat.
ketones?
And it operates really great with ketones. And well, a lot of people, the mental health and clarity of mind comes
Yeah.
even before the weight loss.
Absolutely.
And-
I
and-
tell people, you don't lose weight to get healthy. You get healthy and the weight loss will follow.
Yeah. Yep. One thing that you had written about that I had no idea was how close the butyrate, the ketones body was close to the butyrate
Right.
in butter.
Yeah. I was thinking about that as you were describing your positive experience smearing yourself with butter, which is fantastic. But it's like, butyrate, which is, the fatty acid that's in butter. You get a lot of butyrate. And beta hydroxybutyrate, which is the primary ketone body, sounds similar because
Yeah.
they're very similar molecules and they have almost the identical actions. Both turn on about multiple processes in your body that are highly beneficial.
Yeah.
And so that gets back to your point about why people on carnivore and keto don't seem to need fiber so much. Because
Yeah.
what's the benefit of fiber? The benefit is that it's digested by your microbiome into these short chain fatty acids, chief of which is butyrate.
Yeah. And then
Well, you
you're
probably
just
don't
eating
need
so
as
much of it that you're
Yeah,
fine.
you're
And
getting
then
plenty of butyrate.
it's going right through very
Yeah.
nicely.
There you go.
Helping my nerves, helping the nerves along the way. I mean, you're
Yep.
soaking it in if it's helpful for the nerves.
Mm-hmm.
Look at all the smooth muscle tissue that you cannot work out.
Yeah, right.
It's like working out your internal organs, working out your body that you cannot work out by eating butter.
Right.
Well, some people have like the digestion of milk and stuff like that, and so they can't do some of them can't do butter. But oftentimes when you take out gluten, oftentimes you can add back dairy.
Exactly. That's what's interesting. Kind of a lot of people blame kind of dairy, or they think they're lactose intolerant or something like that. when in fact they go on keto and all of a sudden, hey, I can eat cheese again. I can
Yeah.
eat,
Wow.
other dairy products. And yeah, it's probably from that.
Yeah. Yeah, totally. I am studying to get into a nursing program to become a nurse practitioner. And
Oh,
I just learned today, or I knew kind of it a little bit, but with a ketone, you make more ATP. And like I also learned, like, so you make like 50 instead of 38 from a molecule of the ketone. So like you're making more energy and you skip the part of the process where the glucose has to turn into fructose, then it has to go into something else and something else. Like you bypass it and then it goes into and make more energy for you and make more water, metabolic water. Have you ever heard of deuterium-free water?
yeah, yeah.
Like our body has to use deuterium-free water, like it has to degunk it to get you. I don't know. I'm treading on areas where I don't know, but like there's something about it actually creates more metabolic water for your body that can be used again in your body to do its thing.
It gets amazingly complex very, very
Yeah.
fast, doesn't it?
Yeah.
Yes, that's the kind of one of the hallmarks that I get across, too. Is sometimes the whole energy balance model, of calories in versus calories out. Okay, way too simplistic.
Yeah.
Actually, the picture is what you kind of were describing as the whole metabolism of the cell, which
Yeah.
is huge, right? So, I mean, that's where the whole idea of ketones comes in, because right now, nobody, unless you're on keto or carnivore, the rest of the population is not taking advantage of this metabolically very active, process that ketones provide.
Yeah.
And it's huge.
Yeah.
And that's, a big part of the message of the book is that I think we're missing out,
Where everyone needs it.
Yeah.
Everyone needs it. They need ketones and they need, you can't, I guess, what they say, like, you can't force something, even a good thing, shoved down your throat doesn't taste good. And it's kind of like the evangelizing spirit of what keto is, because of the remarkable stories that come out of it, is like it just has to do its job in multiplication.
Right. I think exactly. It's the power of the testimony here, your story, my story. And as this goes on, you're seeing it catch on.
Yeah.
And people see, I saw a guy today, he's an old farmer, he's lost over 100 pounds and he's kept it off for 3 years.
Oh, through the ketogenic?
Through the ketogenic diet. Yeah. He doesn't have his knee pain anymore. He feels great. He's 74 years old.
Wow. You just feel like awesome. I had lots of things wrong with me, and you don't even realize, you just think, I'm getting older at 30.
Right.
I have healed from back pain. Boron, I accidentally took 400 milligrams of boron at first for the first week, and I had some detox symptoms that I needed more salt for, but my back pain went away, like the stiffness in the morning and the back pain, and I only had like this one area that was a muscle right here in the right side of my body. And when I did my hair mineral analysis test, I was really deficient in salt and potassium. And I was pretty good in calcium and magnesium, because boron helps your body use calcium and magnesium well. Like, I always think of calcifications and I think of boron and K2. Like, those are the first two things. I'm like, boron and K2, boron and K2. So I started increasing my salt and potassium. And this, I had, so it wasn't a kidney, because we already did a CT scan. Like, I didn't have a kidney stone. But I think that maybe the soft muscle tissue was calcified or it was stiff, like locked up. But I increased those two, and I had 2 mornings where I peed cloudy pee. So that's why I'm thinking maybe it was like calcifications coming out. But I had peed cloudy pee, and after 9 years of this one area on the right side being stiff, I done.
Yeah, it's amazing, isn't it? That why we have not thought that how we feed our bodies affects everything else, is incredible. Yeah, I used to have chronic back pain, knee pain. As I said, I don't have that anymore. I can do everything.
And it's so wonderful because we're older now.
Yeah.
Like we're older, but we feel better.
And it's, the age is a number.
Yeah.
But, you don't have to, it's not the natural consequences of aging to have hypertension and heart problems and everything, dementia, and, fatty liver and obesity and everything that goes with it. It's just not.
It's just a metabolic condition getting incrementally worse because your body is not being able to keep up. And if your liver is getting overwhelmed and being like fatty liver with iron overload in your liver accumulating, like you are not, liver function has to be decreased. And if you're going to process all these plants, then you have to use all of your liver to try to make things for your body to use them.
Yeah.
So like I think of K2 MK4 and K2 MK7. K2 MK7 can come from either bacteria and but the K2 MK4 bypasses the liver issue and can just work right away instead of taxing your liver.
Yeah, and we're seeing more and more, some studies coming out showing that it's directly impacting dramatically heart disease risk factors with that.
Calcifications.
Yeah. So it's, again, all those things are super helpful.
And, it's interesting with the whole, so we cured infectious disease with the antibiotics, which are mold toxins, but all of a sudden our heart disease, it just didn't stay still. It went up. And then some people are like, well, it's because we lived longer too. Yeah, but we don't know that. We don't, did it go up because when you take an antibiotic, you're killing your good microbes and maybe not replacing them. And then if you got the infection because you made yourself susceptible because of nutrition deficiency and or environment of mold growing in your home, then you're, snowball down the hill and boom, you got heart disease.
What you're hitting on is, it's very complicated and there's multiple factors that are going in here, Yeah, the interesting thing is if you look across the world, you've got human beings, we're kind of omnivores. We can tolerate a wide variety of diets. You've got the Katavans, which is a group of people in Southeast Asia. They eat these tuberous, very fibrous, plants and stuff like that. And you wouldn't like what they eat, but, insects and whatnot. But, they
How do you know?
They have no heart disease. They've been studied, right? They have no heart disease, no diabetes, no obesity, it's like zero.
Yeah.
And then you've got people like the Maasai, in Africa, a very high fat diet. They are cattle herders. They have a thing that punctures the cattle's jugular vein and they drink the blood directly.
Wow.
And all that. Probably not going to do that. But the fact is they have one of the highest fat diets in the world. And again, no diabetes, no heart disease, none of that for them either. Same with the Inuit Eskimos, Again, there's nothing green up there.
No, they don't have a lot of pesticides around.
No, none of that, right?
Yeah.
So that's
You're not
that's
inhaling
the
a
key
bunch
thing.
of pesticides.
What is the universal thing? You've got the Katavans, which are mostly vegetarian. You've got the Maasai and the Inuit, who are almost completely carnivore, and yet, what are they lacking? There's no fructose. They don't have any glyphosate. They don't have any of the 10,000 some, additives and artificial flavors, colorings, and everything else that we've got. They don't have sugar, which is huge. So all of these things are what's probably going on, and it's affecting our health in dramatic ways. So there's probably, in truth, a wide variety of diets that people could utilize. I think the big thing is get on a whole foods diet. Eliminate sugar and processed food. That's the devil, basically. Eliminate those two things as much as possible, and then you're doing 90% of the work. Then you can talk about,
and then you can tweak it if you need to,
you can tweak it after that.
Exactly. with some good advice from people that know what they're doing. Well, also, you've got these chemicals in the fields. They're actually, I saw this congressional hearing where they were talking about, there's this Aspergillus fumigatus increasing. So even the fungicides and bacteriicides that we're putting on our fields are increasing pathogenic funguses that are pathogenic to humans in the field. And then you think about the microbiome of the plant. Every single plant has a microbiome. So when you eat a strawberry, you're getting some of its microbes in your mouth. Now, if we had some nice stomach acid, which decreases when you age, I learned that from my conventional nutritional book, but they were promoting plants and low protein, and we get way too much protein. I'm like, and then they only mentioned like a paragraph, the ketogenic diet is being investigated for XYZ, but like their whole like bias was, you could tell like someone edited that and been like, no, we're not pushing the plant-based thing enough, and we got to push that. But so I can understand why people on carnivore or keto are able to get out of a crisis faster because of all the bioavailable nutrients, especially in the meat, and and so that your body doesn't have to work hard to get it.
Yeah, exactly. I use the carnivore diet especially for people with intolerances, like you're talking about. It's especially good for that because when you think about it, how does a plant protect itself? It can't run from you. It doesn't have claws or anything. So it has to produce toxins. It has to produce poisons so that, nobody eats it. And so that's primarily, I think there's a lot more people who are sensitive to plant-based products. And so when you put them on a carnivore or animal-based diet, they get better. So that's especially important there. And you got to like meat. There's people who don't.
There's supplements. Some people are really like, you have to be able to work with the patient, right? And like, if they're unwilling, then then you got to try to help them some other way. And like you're saying, the whole foods, like if you can get on the whole foods and then work from there, and then, try. Sometimes stressed vegetables can also produce more of the chemicals and oxalates actually. Oxalates can be increased in that, and I think boron really helps with the oxalates, like decreasing. And a lot of those foods that contain the oxalates actually can do well with the boron. So I'm wondering, like, okay, what does the soil look like under some of these vegetables? So I'm going to be psycho about it. When I start gardening, I'm going to be like, let me take my sample from the leaf sample, and then you can see what the nutrients is lacking, and then go and help the immune system of the plant and help it grow nice and happy.
That's right.
I'll finally look at my notes, but I should probably let you go soon because, I've been generous with myself about your time.
No, that's fine.
There's like, I like how you were saying that the teacher, like doctor means teacher. and how we've just kind of gotten away from that. That was, and also like, I was thinking like, and this might be a personal question. Have you ever been sued with, I mean,
No.
some doctors are so afraid of getting sued that they're just like, I don't want to touch anything that.
No, I agree. Yeah, no, that's a great question, actually. No, I have not, is the answer. But one of the things that I was very careful about doing was, unfortunately, I did this from the beginning, is I've tracked all my patients.
Yeah.
So I've just studied them, and so the results are amazing. We have a 73% type 2 diabetes reversal rate,
Wow.
and we have massive weight loss, and I've had 3 women with PCOS who were able to get pregnant.
Yeah.
I mean, it just goes on and on and on. So as I've been able to present these data, it's like, what do you say? I mean, the numbers don't lie. So
I mean,
people,
like you said, when you were practicing like you were practicing before, you never saw the reversal
no,
in your clients. And I think it's a testament that a testament that they will listen to a doctor when they're telling them to change something, because you have been able to help many of your clients that you had them on your roster that they weren't getting better, and then you're able to say, hey, let's try this. Will you want to try this? And they did it, and they just got off their meds.
Yeah, it's crazy. Some of these patients with diabetes, I put them on insulin 15, 20 years ago, and then I'm taking them off.
That's
and
wonderful.
now they don't have diabetes.
Yeah.
I just never get tired of seeing that.
No.
That's
are you
just
even going to want to retire?
No.
I know.
Because
it's too rewarding. It's like a dopamine hit,
Yeah, exactly.
Yay!
Every time I literally have patients hugging me.
Yeah.
In
Crying
the
maybe
office
even.
now, and their tears and everything else. So it's crazy. In fact, I'll tell you a story. There's a story at the beginning of the book, maybe you'll remember it, where I described myself as an idiot before I knew any of this, telling this poor woman that, she must be eating X number of calories, because I'm holding up an app that tells me how many calories she must be eating to maintain her weight, and she's telling me she's not, and I didn't believe her. And in the book, I described what an idiot I was, and that I never saw her again. And that's not quite true. I actually do see her, and I've continued to follow her. Well, fast forward to today. In fact, just a couple weeks ago, I saw her. She's lost over 100 pounds. She's now, embracing all of this. And I shared with her that she was in my book, about this. And she just starts weeping, thanking me for
Apologizing.
Yes.
You're apologizing. And you're being humble about, hello, we didn't get taught in medical school how to say, I'm sorry.
No, exactly.
I think that when you are an example of this, it can be a cascade. It's hard to be the first to be like, I'm sorry, guys. This is an awful mistake, and whether it was nefariously planned or not, is a non-issue at this point. It's like, let's try to multiply the goodness now that we found.
Let's just try to solve the problem. Exactly. If I've contributed anything to this space, it's just that I'm a regular doc who has instituted this into my practice. So I've had 1,200 patients go through this, like I talk about in the book. But imagine if every primary care doc was doing this.
So, question.
Yeah.
What about your colleagues? We mutually know one of your colleagues.
Oh, okay.
Well, I mean, Greenwald. We know.
Oh, you know the Greenwalds? You know Greenie? Tom Greenwald.
What does he
awesome
say?
Guy.
What does he say about?
I don't know. I actually don't know.
No, you need to get connected with him again and be like, hello.
And stuff. But that would be awesome. I can tell you about my colleagues that I work with here.
Okay.
and actually they're very supportive, and because they've seen the data, they've seen what has transpired,
Yeah.
honestly. And I have to say, probably, I've been in this field here in this area for 30 years, and
Yeah.
I've got kind of some relational capital. I know most everybody, and so they understand that, and they see the numbers.
Yeah,
And
when
so,
you can show them the numbers and the people that you've been tracking, that's very scientific.
right,
So
I
they
mean,
should,
so
they
I'm
should be able to listen
so
up a little bit.
fortunately, I haven't had problems that way. So
Yeah.
not
So,
yet.
are they interested in doing it themselves, or are they just tired and not wanting to learn a new thing?
I think we're seeing, especially younger physicians
Yeah.
coming along that are probably more interested and more open to trying these things. I think more and more younger physicians are interested in, looking at, functional medicine and things like that. And I think this metabolic medicine, as I call it,
It's wonderful.
should be the
Yeah. I mean,
I
I
think
just
it will
think
be
about
standard of care.
the Casey and Callie and Casey, is it Callie and Casey means the twin, one's a MD and one's a he used to be a lobbyist for the pharma. Have you heard of them?
I don't think so. No.
So get ready, because I just feel like people are going to have more and more interest in keto and all that stuff.
Yeah.
But their mom had multiple different symptoms of metabolic disorder, and then she got pancreatic cancer because she was hiking and she got a pain in her pancreas area, and in 13 days she was dead. And so they were just like, that gives you passion. They loved their mom. Fortunately, she was a good mom, obviously. She was traumatic thing. And they were like, there was warning signs, multiple warning signs all throughout this time. Here's a selfish question. I love iodine. And have you asked your clients where they're getting their iodine from?
I have not generally, but you're right. I mean, iodized salt is, obviously a great thing. I mean, it was put in there because, we didn't have iodine sources very much anymore, and goiters and everything. You don't see that much anymore because of that. So, yeah, it's actually critical for
And
thyroid
iodine
development.
isn't only just the goiter thing. It is immune. Oh my goodness, I only have 20% battery on my phone, but the immune system, the PCOS, like you were saying, breast cancer, the pancreas also happens to concentrate iodine. But if we don't have any, you think about insulin resistance and all of the, your digestive enzymes and all that stuff, all the things that the pancreas does, and you think about it not concentrating the iodine, and then iodine and boron, those are my pets, because, so iodine is to the thyroid as boron is to the parathyroid. And it's interesting that boron is really helpful with insulin resistance, and so is iodine, but boron in particular, and hormones. But I was looking in my text, in my studies that I'm doing, and the spots where there are the Langshan sign, yes, and also the parathyroid, they both have denser tissue. They're both similar in nature. So I kind of wonder to myself, in the future, I think I might have to become a scientist.
I was going to say, I think you've got a questioning mind that
Yes.
you probably need to explore in that field.
So to relieve you, I said that I wanted to ask you the question in the future for future research ideas for people, because I do think that we are going to have an explosion of scientists in the future. I think people are going to be interested in the science if we can keep it less colluded. I think it'll be interesting. Science would be interesting.
That would be awesome. Yes. I think if we can, especially if we can get funding, that's not from drug companies and things like
Yeah.
that kind of is a problem. Once
Yeah.
money gets involved, it gets hard to keep bias out. Yeah, for sure.
So can you think of something that you would be like, some kind of question maybe in your mind that you're just like, if they research this, maybe that would help with this?
Yeah,
Or something.
I would think, really one of the biggest barriers, I think, from keeping keto from going, mainstream is probably the concern about heart problems, whether it's effect on cholesterol, especially LDL levels, or saturated fat, and I think the saturated fat question's been answered. That clearly does not cause heart disease. And that's been asked and answered. We've been looking at so many, in fact, I go through that in the book, and that just needs to get into the mainstream. But I think to look at a ketogenic diet per se, especially in people with heart disease, and if we could show benefit. So I think that would be huge, because there are some studies. I saw a study looking at people with congestive heart failure, and they infused beta hydroxybutyrate into them and saw an 8% absolute increase in their ejection fraction, which is pretty huge, actually.
Wow.
And because they knew the physiology of how the heart uses beta hydroxybutyrate with heart failure, and that was very beneficial. So it's like, wow,
Yeah.
guys, what would happen if we then treated people with heart failure with a ketogenic diet?
Yeah, I saw that. I went ahead because I only got to a third of the book done, and before I interview, maybe you'll come back on if you can stand it. But I saw that a scan that you had taken,
Yes.
or a client of yours had taken, and the glucose was injected or drank, or injected or whatever, and it went
It's-
to the heart in one. But then in the
Right.
next one, when they were ketogenic, they must have been in
So-
ketosis, and then
Well, that was right. So that was that scan that you see is a PET scan and positron emission tomography. And the way that works is they radioactively label glucose and inject it into a person. And then glucose is taken up by very metabolically active tissues, like your brain, your heart, but also cancer. So that's why cancer cells light up on a PET scan.
Okay.
It's because they're actively taking up this
A lot of
radioactively
glucose.
labeled glucose, right? So that was a cancer patient.
was her breast cancer up here? Is that what that little dot
That was
was?
the lymph nodes from it, yeah.
Okay.
And she had mets in her liver and stuff like that. So this was a study looking at 30 some breast cancer patients like that, put on a ketogenic diet, and then they did a PET scan before and then several months later. And what they found, the main finding of the study, was that the metastases decreased in size.
Yeah.
So that's great.
Just
But
keep it up.
what was also true, and the reason I had this picture in the cardiology chapter,
Yeah.
is every woman that was studied in that fashion who was on the ketogenic diet on the PET scan, the heart lights up initially because it's very metabolically active
Yeah.
tissue. Every woman's heart disappeared on the ketogenic diet. And the reason being is the heart was not running on glucose. It wasn't
Yeah.
taking up glucose. It was running on ketones.
Yeah.
And so it just shows you that even in these women who had no heart problems,
Yeah.
right? They had cancer. They had no heart problem. Their heart took up ketones
Yeah.
rather than glucose. So it's like, okay,
Yeah.
guys,
Let's-
there's enough evidence here that we should probably start studying this
Oh,
for
yeah.
people with heart disease.
Yeah.
And if
Well,
we could show that it was beneficial in that, I think that would make, because heart disease
Yeah.
is the biggest killer, right?
yeah.
So if we could show keto was beneficial rather than detrimental
Yeah.
for people with heart disease, that would go a long way.
Yeah, definitely. They also in Cell peer-reviewed journal was talking about how in every cancer they find fungus and bacteria, and then they're like, we don't know what the other tissue is like, so I'm like, well, you think you would just be like, wow.
Yeah.
Let me see right away. Like, let's high speed this study to study the microbiome of the normal tissue. I think we're all abnormal now. Like, we have microbes where we shouldn't have them. And
if you biopsy people with coronary disease every biopsy of that artery that's got plaque has bacteria in it. Okay, so we know that, and that's been a proven thing.
I
for
wonder
years.
if they've done fungus. I wonder if they just don't think about fungus. They don't. They just biopsy they do the test for the bacteria, but they're not looking at the fungus. But it would be interesting. I was thinking, I wonder if the calcifications have more to do with calcified biofilms in the body. Because there's a lady that was pregnant and she had it died inside of her. And you know what the body did to protect itself? It turned it into a stone.
Yeah, it calcifies it.
In her body.
That is the end product of inflammation. So inflammations, that's why your plaque calcifies, that's the end stage product of inflammation is calcification.
Yeah.
Yeah.
And that boron, that K2, and I love my iodine, and I love my fat. And keto is amazing. Keto.
Right.
So all right, so let's see. I guess I can let you go. Yeah. I liked that. Overworked, overloaded, and overwhelmed. I can pray right now. Okay?
Great.
All right. God, thank you so much for the time that we've gotten to spend together. God, I pray that you help people stop feeling overwhelmed and overworked and overloaded. God, I pray that you help their healing come. In Jesus' name, God, I pray that you just are able to transform so many things about people's lives, that they're able to be nourished, not only in their flesh, but in their mind and in their spiritual walk. God, in Jesus' name, I pray. Amen.
Amen.
Oh, one thing about iodine, I'll leave on this note, but one thing about iodine is my anxiety completely dropped when I started doing iodine. And I was just, and also my friend, I'll give you this tidbit. My friend who was, she chewed tobacco. And I didn't know that she chewed tobacco, but I knew that iodine is important for neurotransmitters. And I thought, well, acetylcholine, the only thing that can, or is it acetylcholine? The only thing that can fit into the receptor is nicotine. So when you have enough acetylcholine, if you smoke a cigarette, it makes you anxious and vomity. But if you don't have enough acetylcholine and it clicks in that receptor, you have peace, And so like when I see someone smoking a cigarette, oh no, alarm. Uh-oh, it turned off. It's okay. All right, when I see somebody smoking a cigarette, it's still recording on the computer, so it'll hear me. When I see somebody smoking a cigarette, I think iodine deficiency. But it's also like, it wouldn't be only iodine deficiency, because like there's more than one ways to skin a cat.
Yeah.
There's more than one ways to skin a cat, and there's more than one ways to increase your normal production of acetylcholine. So anyway, thank you for spending time with me. We didn't even go through your slides, but it's fine.
That's fine. If you can use anything there, have at it. Otherwise, thanks for having me.
Okay, thank you so much.
All right. Take care, Lizzie.
Bye-bye.
Bye-bye.